The biggest developments today, and well, it's been from one virus to another. Now South Africa recording its first case of monkeypox just a few hours after government lifted the compulsory use of masks indoors and restrictions on gatherings in terms of the COVID-19 health regulations. Let's bring in the Minister of Health now, Dr. Joe Phaahla, who's joining us on today on eNCA. Minister, good afternoon. Welcome to eNCA. Thank you very much for your time. It's been quite a busy morning for you. We appreciate you giving a few minutes of your time this hour. Can we start with the monkeypox in case some of our viewers still have some questions? There's only one case that has been discovered in Johannesburg so far, nothing more.
Well, so far it's just the one case which has been discovered in Johannesburg. So there will be what is called the contact tracing to follow up on the particular patient who has tested positive, make sure that people who are closer to him don't have any symptoms, and if they do have symptoms, get them tested. And so that's where to start. But at this stage, only one person who has tested positive. Yes.
Is it an easy condition to treat?
Well, to start with, it's not, generally speaking, it's not a severe illness. Let's start there. So in many cases, people can be most of the time, it's a mild disease where not much of intervention may be required, very mild symptoms in terms of fever, the usual kind of viral symptoms of fever, headaches, and then, of course, also with a specific rash on the skin. So it will be more of your largely symptomatic treatment and largely very mild.
Yeah. So if you have it, you have to be stay at home, isolate yourself, and treat the mild symptoms if you've got fever and things like that. Is it easily transmissible?
The transmission, it's strictly in terms of a direct contact with the infected person. So it's not an illness with which, if you are in the same environment, even if it's in an enclosed environment, by simply being in the proximity of a person who's infected, it will not rub onto you. So it requires direct physical contact with the person who is infected with the virus.
Okay,
so for that reason. Yeah.
Okay, thank you, Dr. Phaahla. Yeah. Thank you. Let's now shift our attention to the lifting of the last of the restrictions under which the country has lived since March 2020, when the coronavirus hit our shores. Just an overriding question first. What do you think is going to be the impact of the latest move that the government has now done?
Well, we are again balancing the risk in terms of on the side of the disease, in terms of protecting citizens from being infected with the virus and the risk of serious illness, balancing that against more social activity and especially economic activity, because people have suffered a lot over the last 2 years, 3 months. So in terms of balancing that risk, the risk of severe illness, even if you do get the virus currently, as we have studied now almost over 7 months from November last year when the Omicron broke out, we believe that the risk of getting the virus is still there because it's still in our midst. The risk of serious illness resulting in hospitalization and ICU is very low. So that's what has led us to believe that with that consistency for more than 6 months now, it's time to can allow people to really get into social activity, visit families, get those family gatherings, birthdays, and so on. But more than that, economic activity, a lot of have suffered in the in the entertainment industry, in the sports area, in the hospitality. So all those activities which bring income, we believe it's safer now to can get back into them.
Yeah, because those economic activities have taken a pounding under the restrictions. Now it's going to take some time for them to recover. And your reflections are that you are creating a new balance into the system. But also, we need to be mindful, as you've said, that the virus is with us. It's going to be with us forever, as some scientists have told us, like most viruses that have come into this world for which there are vaccines. You are still urging people who are vulnerable, though, to be mindful, and that even if we are no longer required to wear masks, they need to be mindful that they might have to protect themselves.
Well, in fact, I would go further, actually more stronger to say, we now know a lot. We know that with age, above 50, and the further you are above 50, the more risk of severe illness, the more you also have other what has been called comorbidities, like in terms of hierarchy, sugar diabetes, high blood pressure, heart disease, kidney disease, anything which has to do also with maybe on treatment for cancer, being on treatment which reduces your immune response. All those things put you in the risk of serious illness with the COVID virus. So one would therefore go stronger to say, if you are in any of those categories, the risk we know indoor spaces where there are many people, especially with poor ventilation, make sure that you wear your mask, especially your surgical mask, which has better filtering of particles. If you are in those categories, if you're going into that setting where there are many people, especially indoor, please continue to use the mask.
Vaccination is still a good thing to do. I see government saying going to use the World Bank loan to buy more COVID-19 vaccines. Recently, you urged people above the age of 50 to go for their second Pfizer booster shots.
Definitely, to take us, as you have correctly said, that what we are looking at is what is called the endemic phase of the COVID. In other words, is going to be around with us. It's still slightly more riskier than the normal flu, but what we believe is that we're getting into that arena now where COVID increasingly will be an endemic viral disease, respiratory viral disease, even though if it complicates, it can be more than your flu virus, but it's going to be in that category. So it's going to be important that we use the vaccines to make sure that the risk of serious illness is diminished, and as more and more people are protected, even the risk of higher transmission, even in an endemic phase, will be less and less. So definitely, vaccination is the key word, especially for the more at risk, 50 years and above, but also with the young people, because they can, even if they may not be seriously ill, they are still going to be carriers if they are not vaccinated. So everybody who qualifies above 12 years, we urge those who have not yet been vaccinated to please come forward to take their jab.
Did you take longer than necessary to lift the restrictions, do you think? Or you err too much on the side of caution to mitigate the risks?
Well, our belief was that it's better to err on the side of caution, because here we're talking about lives of people. And, part of what I recounted in the press briefing was just to remind us where we come from, the stresses, the loss of lives of colleagues, and that we can't take that light. So our belief was that as a public service, we need to err more on the side of caution. There are those who believed that we took too long, but we have also seen countries which have rushed because of the pressure to open up for more economic activity and then have to retreat. So we are convinced that with the kind of cautionary approach which we have taken, we are more likely to be better stable going forward rather than to and fro. We are optimistic that we are not going to have too much of a to and fro as a result of spikes, significant spikes, which are going to then put us in serious danger.
Okay, finally, Minister, before I let you go, the issue of being winter, yes, the fifth wave is gone, as you've said. The numbers have declined, hospitalizations, severe illness, positivity rate, all those metrics that you and your scientists have been monitoring are going down and going down regarding COVID-19. But I hear some people just talking anecdotally, oh, is this a good time in the middle of winter to be lifting these restrictions? A brief answer from you. I know you're a medical doctor as well. Perhaps you could share some of that with us.
Well, briefly, it is a good concern because we know that respiratory viruses tend to spread more during the winter for various reasons. We are more indoors, and also with the cold weather, our immune system, also tends to be compromised. But it's just that also we live in close proximity during winter periods. So it is a risk, but that's why we have waited up to this stage, because we are now almost towards the end of June, and from just the middle of May, and our winter this time started early, so we had to monitor. So we're quite confident at this stage that, notwithstanding the fact that we are in the winter period, we have had enough experience of about just over 6 weeks of cold weather. And within that, we have not had any surprises in terms of, where there was a bit of spike, it's already going down. With the remaining, our winter is not very long. We are left with maybe about 4 to 5 weeks of serious winter, and then it's going to get better. We can live more outdoors. So we don't think that at this stage, with a bit of 4 or 5 weeks of remaining winter, there is much risk.
Thank you very much. That's Dr. Joe Phaahla, the Minister of Health of the Republic of South Africa, talking about a little bit about the announcement he made a little bit earlier. And of course, that was gazetted yesterday. But now let me